As the myth-busting orthodontist, I hear time and time again that every patient should be treated without the removal of teeth. In other words, they should be treated with a non-extraction approach. And what do I say about that? Absolute garbage. We have to understand the diagnosis on a patient-by-patient basis. So let's understand what happens when you treat a crowded case without resorting to dental extractions. And most of our patients, I agree, should be treated without dental extractions. But there are certain patients where you resolve the crowding, the teeth have to go somewhere. And the teeth always find the path of least resistance. So for us to resolve a crowding situation, the teeth have to be brought forwards. Now there's this fallacy out there that all we have to do is expand the arch to get the room. We expand the arch, make that arch wider. But what's interesting is for every 4 millimeters of expansion, we only get 1 extra millimeter of arch length. So in other words, if I had 8 millimeters of crowding, I would need 32 millimeters, over 3 centimeters of expansion to get the room for the teeth to fit in without those front teeth coming forwards. Well, that's not going to happen. So generally speaking, in non-extraction cases with crowding, the teeth are going to come forwards. And when they come forwards, the bite tends to open. So if you're a patient already and you've got protrusive incisors with crowding and a minimal overbite, as you treat that patient without extractions, the teeth are going to come further forwards, making their teeth even more protrusive, and the bite's going to open even further. So there's never any question that we can fit all the teeth in the mouth. The question is, should that patient have all their teeth in their mouth? And we see this with a lot of Asian patients who have very full lips, and the last thing they want is the teeth to come further forwards. So at the end of the day, yes, we try to avoid extractions, but at the end of the day, some patients do require dental extractions. And there is nothing in the research that says to us that by extracting teeth we reduce the airway, because that's another part of the myth that coincides with treating patients without resorting to dental extractions. So all in all, you have to look at the individual patient on a case-by-case basis to get the right diagnosis and the right treatment plan. So my question to you is, what are you going to do to learn how to find out which of those patients should require extractions to help resolve their crowding, and which of those patients should not have extractions as part of their orthodontic care?